I'm Matthias Radatz. I'm a consultant neurosurgeon and radiosurgeon in the United Kingdom. I have a surgical practice, that means an invasive practice, and a radiosurgical practice, which is minimal invasive. So I treat many patients on the operating table, as well as many patients who are undergoing stereotactic radiosurgery whilst most of them are awake. I decided to become a doctor because I always enjoyed the natural sciences, and studying medicine was involving all of those. So there are not many subjects where you have the benefit of requiring biology, chemistry, and physics. Additionally, I was always quite dexterous and manually skilled, and I always was intrigued to become a surgeon and to help patients who have a problem. That was really the origination of going into medical school. During medical school, my training, I was always fascinated by the function of the brain and the central nervous system, and that took me into neurosurgery. When I came to Sheffield during my training, I was privileged to work with the father of stereotactic radiosurgery outside Sweden, really, and that was David Foster. So I was in the very much forefront of learning the first applications of stereotactic radiosurgery, where in the very early days of it. So I've been exposed to that, and was always fascinated by the way a disease can be minimally invasively treated, and how that can avoid the sometimes very devastating side effects of open surgical interventions for tumors in the skull base and large arteriovenous malformations. And finishing my training, I came back to Sheffield to succeed David Foster when he retired. Most rewarding for my job is really the fact that I'm helping patients, that I'm in many circumstances transforming their life and bringing them back to what they experienced before they noticed that they have an illness which potentially would cause them serious neurological problems or potential early death. So it is very rewarding to be able to do that. I think the most value patients have from me or see in me is that is the level of experience I have with regards to stereotactic radiosurgery. Having been exposed and dealing with very complex diseases for over 20 years as a consultant in a center which treats over 1,000 patients a year. So my personal wealth of experience, I think, is what individuals value most. That, I think, is the giving them the trust that they get a very balanced view. And I think that is what I value on my patients as well, that they come and they see that I'm there to give them a balanced view, to make an informed decision what I think they will finally decide is their best way forward for themselves. And I think that is a principle of good medical practice, is that you discuss what the options are, what the benefits and the risks are, and to tailor a treatment pathway for each individual patient, and that they can trust me that I'm on their side.